If you've been diagnosed with FAI, hip impingement, or labral tears, you're not alone. Dr. Nicholas Mercer with You Improve PT. So, if you've read anything about me on youimprovept.com, you know that I have a long history of hip pain and surgeries, and really this is what this video is going to be about. So, a lot of people, it's a more common diagnosis of what we call femoral acetabular impingement. You may know it as hip impingement, and a lot of times that comes with labral tears. With that diagnosis, you get a lot of grinding and clicking and pain inside of the hips. And when you're going through it, it doesn't really seem like anything is going to help. Now, personally, I'll take you kind of through my story, and it's one that I've heard a lot. So I was about 21, I was having knee pain, and I went to the doctor. They took x-rays, MRIs of my knees and my hips, and they said, there's nothing wrong with your knee. You have extra bone growth on your hips, and that has torn the labrum in both hips. Keep in mind, I was not having any hip pain. And so I was told, I was 21, I did not know a lot about, this condition. I didn't know how to look up the right resources, and a surgeon was telling me I needed surgery. So what did I do? Obviously, I had surgery. I had surgery on my left hip first. The surgeon shaved down the bone so that it looked like a normal femur, and they clipped the labrum so that it wasn't sticking into the joint. I asked, is this going to fix my knee pain? I was told, yes, this will absolutely fix your knee pain. And after the left one was done, I recovered, and then I had the right one done. All this time, that's about 6 months, I was not able to exercise, practice martial arts, stretch, do the things that I love to do. So obviously this had a huge toll on my mental health. And mental health and physical pain and exercise, especially when you define yourself as an athlete or a martial artist or just an active adult, those are very, very, very connected in both ways. And that's, I'll save that for another video later on. But so I had both hip surgeries. I started doing martial arts and exercising again. And my knee pain was still there. And now I was having hip pain. And I went back to the surgeon, and he said, let's take some x-rays. Took some x-rays. My hips looked the exact same as they did before having the surgery. And I was told I needed surgery again. So me, being what I like to think of as a logical human being, thought, I should get a second opinion. I went to another surgeon. The other surgeon looked at it, and he said, yes, we need to do surgery again. However, this time we're going to shave down the bone and repair the labrum so that we don't get it to re-tear. And that sounded better, but I still wasn't ready to go through surgery again. So I decided, you know what, I'm young, I'm going to continue doing all the activities I love. Now I know where this pain is coming from, I will just deal with the pain. That sounds like a great plan until the pain gets worse, and it keeps you from doing the activities that you love and that make up a huge part of your life, and in my life in particular. So what did I do? I did what any other person my age, super active without a social life, would do, and that is look up a lot of mobility exercises and strengthening and find as many resources as I could in order to get some relief in my hips. I went to several physical therapists. I went to a few chiropractors, other orthopedic specialists, physiatrists. I drove to a physical therapist in Tampa, which is 2 hours from me, twice a week in order to try to get my hips better. And no one really could seem to really get a grasp on my issues. And obviously that was very depressing. And I realized that, the person who knows my body the best is me. The person who knows what movements bother me the most, what pain I'm feeling specifically, and what symptoms I'm feeling is me. Now, I had a lot of people telling me this pain is all in your head, and I hate that. I really, really hate that. I would never tell that to a patient, because pain is pain. If you're feeling pain, you're feeling pain. Whether that has a neurological source, a physical source, whatever source that pain is, if you're feeling pain, you're feeling pain, and nobody else has the right to tell you that you're not feeling pain. As long as you're not lying and you're actually feeling the pain. In a way, it is all in your head because that's how you process pain, but it's not all in your head like you're making it up. There's a source. There's some type of source. But that's just something that really frustrates me. We're going to go back onto the topic. So I got took what worked from these various different practitioners and continued those and started to figure out what makes my hips feel better, what makes them feel worse, and how can I get certain other muscles activated, do certain stretches and mobility exercises, change the way I move in order to not have this pain. And that took a very long time. That was about, I started this journey 8 years ago, and in the past few years has really been the most significant improvement that I've seen as far as being able to do whatever I want. I was even told by a physician assistant, an orthopedic specialist, that I should never squat below parallel. I should not be practicing splits. I should not be doing martial arts. I should not be high kicking. I'm doing all that right now, and I'm having no hip pain. I'm squatting, a few days ago, I squatted 245 past parallel. My butt was almost touching the floor, and I had no pain. I did splits yesterday, no pain. I kicked over my head yesterday with no pain. And that took a lot of work. And the reason I became a physical therapist is so that people would not have to go through this, because this took a very long time. And I know my body very well. And so, I'm never going to tell my patient that I know their body better than they can. But what I can do is figure out, where are your movement problems? Where are you weak? Where are you not controlling? What movements are you not controlling? What do I understand from your symptoms? And give you the best information that I can, or that any practitioner can, for what your issues are. And then you, using mindfulness, basically just the knowledge of your body, awareness of how you move, being very aware of where your pain is, what type of pain it is, what your symptoms are, and going through these tools, these techniques, and figuring out, this makes me feel better, this makes me feel worse. And really figuring out, okay, I gave you the knowledge that you need from what I could see. You take that knowledge and the techniques and the exercises that I'm giving you, and if one doesn't feel that great, stop doing it. If one really helps you, keep doing it, right? So I wish I could say that I had the perfect solution for everyone, but everyone is so different. Everyone's body is so different. I can take what I see as a healthcare professional, as a doctor of physical therapy, give you the tools necessary, and then with feedback from my patients, and then feedback from me visually seeing and listening and understanding what they're going through, continue to guide you on your journey, on my patient's journey to getting them better. Unfortunately, that's not what I see with a lot of pain professionals, people who treat pain. And that's why I became a physical therapist, to be the resource that I did not have when I was going through these problems. Now, again, this is just a personal story from me, but there's a lot of evidence to suggest that for this condition, specifically FAI, hip impingement, labral tears, surgeries don't have a great outcome a lot of the time. And that's because, just because a structure is different, that doesn't capture movement. Everyone is built a little bit differently, and so if we all move properly the way our bodies should be moving, even if we have these structural problems in the joint, it doesn't always have to cause pain. Now, I'm not going to say I'm completely problem-free. I still get the occasional hip issue, back issue, knee issue, but I now know what I can do in order to decrease that and manage that. So that's just kind of a quick rundown of what my life looks like and how I like to treat my patients. And that's why I started You Improve PT, so that I could be that resource for them, give them very, very specialized one-on-one treatment, manual therapy, exercise prescription, without insurance companies or other doctors telling me what I need to do, because really they did not spend an hour evaluating their patient. They spent maybe 15 minutes, and they didn't check how they moved. They didn't check they really didn't get down into what is really the cause. Is there any mental health issues coming into it? Because if you have pain, that can make you depressed, and depression can increase the sensation, the feeling of the pain, and it just becomes that vicious cycle. So I understand a lot of conditions and feelings and experiences that people are going through, regardless of what body part it is, because I've had a similar issue, and I don't think a lot of people really take that time and understanding to understand their patient, what their priorities are, and really take the time to look at their movement, look at their deficits, and come up with a specialized plan to make them better that will work for them and the activity that they want to do. So I know this was kind of a long spiel, but it was about me. I got to talk about myself. Everyone likes to talk about themselves. So if you'd like to learn more about me, how I work with my patients, and about You Improve PT in general, go to youimprovept.com. We also have a lot of free resources on improving various different types of pain that, while not super specialized to you, they can kind of get you started on your journey to understanding your body and your problems. And if you have any questions or want to get in contact with us, please go to youimprovept.com, send us an email, give us a call. We'd love to talk to you about what your issue is, set up a free phone consultation, or even a free discovery visit where we can kind of plan out the next steps for you to start ending this pain and managing it to find long-lasting relief. Also, subscribe to our YouTube channel for more videos on improving your movement and improving your life.